Yep.
Okay. So first thing is did you know that there's a policy and procedure for EKG placement?
No.
There is. It's a policy and procedure. It has a typo on there, but for the most part, V1 and V2, we know it is nipple line or where nipple should be, but it's technically fourth intercostal space at the sternal border. V3 says that it should be between V2 and V3. However, V3 really should be 4 should be nipple line, but it's actually mid-clavicular, and then 2 should be just to the left of it if you're looking at the patient. 6 should be mid-axillary at the fifth intercostal space, and then this one should be in between the two, following the fifth intercostal space. Limb lead should be placed on the limb, on a fatty portion of the limb, or never on a bony prominence. You'll see in triage that we do this sometimes, put them on the bellies if they're wearing really tight pants or stockings and we need to get the EKG quickly. But if the patient's in the bed and they're disrobed, always try to put it actually on the limbs. Other thing for cath lab that we hear them complain about a lot is that these are placed like so on patients. And they really should be anterior posterior to give them more space, especially for their imaging for when they're doing the cath procedures. You can see through these, but it just, however, gives them a better image if they're not having to see them. So try to always place them as best as you can out of the way, but also still effective for the patient. Good? Okay, so that is that. We wanted to talk to you about the IVs, 2 large bore IVs. We do not want any IVs in the right lower portion of the extremity. No wristbands, no IVs. If it's the only IV site you can get, that's fine. We're just charting that patient has a tough stick. So that way, if they decided that they wanted to go through the wrist instead of the groin, that this area is clean for them, clean and free. Heparin is one of the things that we wanted to bring up. Do you know what the standard bolus is for the Stemi patients? 5,000 units. 5,000 units that should be given after a physician has read over the chest x-ray. We want to make sure that the patient doesn't have a tear or something of that sort, and then you can give your 5,000 units. We have a total contraindication for nitroglycerin, and it is a certain type of MI. Do you know which MI it would be? It's inferior. Inferior can be identified on an EKG by leads 2, 3, and AVF. And if you see, it's the 3 leads that are on the bottom left. It makes the shape of a boot if you're looking at it. Okay. 2, 3, and AVF elevation. We should be running it by a physician, making sure that that is indeed what they want. Maybe they didn't see that it was elevated in those leads as well. Okay. The drawing order for what we're getting, we are missing. We're always getting the rainbow. We're obviously really good at that, but we're forgetting that once we get the green, the techs cannot always run the point of care. If we have an LPN, they can, but if we're having techs in the room, they set it on the countertop, and then they're not always getting ran just because there's so many people in the room, and sometimes we overlook who's done that. So it's a primary nurse's responsibility to make sure that that's actually being ran or cooking. The other thing that we're missing almost all the time is pink tops. Pink tops is a part of the new protocol set for STEMIs. They need to be drawn, patient needs to be banded for the blood band, and that needs to be sent down. We had a patient who went and had a really bad bleeding out episode. Regardless, he could have gotten emergency blood, but we neglected to get the pink top, and so we're going to get the version of that. Okay? And that's the most important things that we're missing in our practice for the STEMI